Hello everyone. I am VC Sridharan, Assistant Professor from the SNS College of Physiotherapy. In this video, we're going to see about the topic is nothing but an endocrine glands. First, we're going to move on to introduction for the endocrine glands. First, so generally these endocrine hormones. So what is hormones? Hormones are nothing but chemical messengers which are majorly secreted by the two different types of glands. So one is endocrine gland and second one is exocrine gland. In this topic, we are going to see about the endocrine hormones which are secreted by the endocrine glands. So majorly, the picture in the right side that shows these are the glands which secretes the hormones which are known as the endocrine hormones. First, we're going to see about the parathyroid hormone. So this parathyroid hormone mainly helps in regulate the growth level and the metabolism rate, and also helps in balancing the calcium and the phosphate level. And second, we moving on to thyroid hormones. This thyroid hormone which is secreted by the thyroid gland. This thyroid gland present at the level of T3 and T4. So this thyroid hormone mainly helps in regulating the metabolism rate, and it also helps and regulate the growth and the development of the human body. So now we're going to see about the parathyroid hormone. Generally, this parathyroid hormone mainly helps in regulates the actions over the bones, kidney, and the intestine. So first, we're going to see about what are the physiological actions that takes place at the bone, which by helping the parathyroid hormone. So generally, in the bone, this parathyroid hormone increases the osteoelastic activity, which helps in growth of the bone, and it also releases calcium into the bloodstream. Then, while seeing the kidney, it increases the calcium reabsorption, and it also decreases the phosphate reabsorption and activates the vitamin D. Next, in the intestine, it increases the calcium absorption via vitamin D. Next, we're going to see about the regulation of the parathyroid hormone. So generally, it is regulated by the serum calcium levels. By reducing the serum calcium levels, there is increase in the parathyroid hormone secretion. If this parathyroid hormone is secreted reduced rate, there is increase in the level of serum calcium level. So it shows the negative feedback mechanism via vitamin D, which inhibits the parathyroid hormone secretion. Magnesium levels also influence the parathyroid hormone releases. So if suppose this parathyroid gland gets diseased or get inflamed or injured, it may cause a severe conditions such as first one we're going to see about the hyperparathyroidism, which is caused by the parathyroid adenoma, and then it also can leads to the chronic kidney disease. So features, some of the clinical features which are caused by the hyperparathyroidism are: first one is hypercalcemia, then bone pain, fracture, kidney stones, and it also leads to the muscle weakness. If there is a condition which is known as the hypoparathyroidism, the parathyroid gland which secretes the hormone in the low level, which causes the post thyroid surgery, and it also leads to the autoimmune disorders. So some of the clinical features which is shown by the hypoparathyroidism are: so first one is hypocalcemia, which is the level of calcium level which is reduced in the bone. Second one is tetani. Third one is muscle spasm, and the fourth one is squastic and Trousios sign. Next, we moving on to see about the thyroid gland. So thyroid gland secretes the thyroid hormone. So the thyroid hormones are nothing but the triiodothyronine and the thyroxine. These are the hormones which are secreted by the thyroid gland. So the physiological actions of these hormones are: increase the BMR. BMR is nothing but the basal metabolic rate, and it also increases the oxygen consumption level. It enhances the carbohydrate, fat, and protein metabolism rate, essential for the growth and central nervous system development, and it also increase the heart rate and the cardiac output. Next, we're going to see about the regulation of the thyroid hormone. So majorly the hypothalamic, pituitary, and the thyroid axis, These three glands are correlated and interlinked with one another. So the hypothalamus mainly helps in the TRH, and the pituitary gland which helps in the TSH, and the thyroid gland which is secreted as an T3 and T4. So T3 and T4 are nothing but the thyroadenine and the thyroxine hormones. So hyperparathyroidism, it is an so generally we're going to see about the hyperparathyroidism, which is nothing but the disorder of the thyroid hormone. So hyperthyroidism is a condition in which the thyroid gland produces and releases the excessive amount of the thyroid hormones, which leads to the some of the different conditions causes such as Graves' disease, thyroid adenoma, excessive iodine intake. So the clinical features for this hyperthyroidism are weight loss, heat intolerance, tachycardia, tremors, nervousness, and hypothalamus. So next we're going to see about the hypothyroidism. So hypothyroidism is nothing but if there is an insufficient amount of secretion in the thyroid hormones is known as the hypothyroidism, which results in decrease in the body's metabolic activity. So the causes are iodine deficiency, Hashimoto thyroiditis, thyroidectomy, and the clinical features for this hypothyroidism are weight gain, cold intolerance, bradycardia, lethargy, and dry skin. So summary on this topic is this parathyroid hormone regulates the calcium and phosphate balance, whereas the thyroid hormone regulates the metabolism, growth, and the development of the human body. The hormonal regulation occurs via the feedback mechanism. The disorders leads to the significant metabolic and the neuromuscular changes. Understanding the endocrine physiology, it is essential for the clinical practice. So thank you.